At that same press briefing, you recall on PM Express last night that he told Evans Mensah the government is projecting a total of about 15,000 deaths in Ghana from coronavirus. Listen.
We have 30 million population here. We expect that about 10% of the population may be infected. And out of the 10% of the population,
so is that our projection?
Yes, we have that projection.
Okay.
Out of the 10%,
so no, I'm just yes. hoping that this is not this is what we projected.
It's not hypothesis. That's what.
So Ghana is projecting that 10% of the 30 million population will be infected.
I'm coming. 10% may become positive, but out of the 10%, 80% of them may not show any signs and symptoms at all.
So that is our projection.
And 5% of them will be very ill.
Okay.
That's the projection. So
let me break it down. This is important.
That's the reason why
I'm just hearing this for the first time, so it's important just to break it down.
Yes.
Our projection, our modeling says we expect 10% of the population to be infected, positive. 80% of them will not be critical.
Yes, that's the projection.
5% will get critical.
Yes.
How many do you expect to die?
If you look at it, I think about 5%, the 5% who get critical, about 10% of them will die. That's how it is. That's how the modeling is.
So
that's how the modeling is.
Okay.
So, but because what we have seen in Ghana, and for that matter in Africa, that this modeling doesn't maybe will not even be the case in Africa, because we are not seeing critical cases. And I've given you the reason, and if you look at the cases that you are seeing, the number of people who are in critical condition is very, very small.
Yeah.
Even out of the 1,042 that you had, or those who have symptoms of 380, 4 of them, sometimes 2, 9 of them unfortunately have lost their lives. So it means we have a situation where this hypothesis may not be the case in Ghana.
But we are
preparing for this.
That's what he says we're preparing for. Well, there have been some clarities to all that he said. At the news conference today, he earlier provided those clarifications on the projections that he has made. Dr. Nsia Asare says he based his projections of Ghana's COVID-19 situation on a hypothesis by the World Health Organization.
Yesterday, I was at JoyNews and I gave a hypothesis, which is a hypothesis that WHO put out, which is based on population of the country. And that's the hypothesis I gave, that if Ghana stayed without doing anything at all, that's what will happen to us as a country. That's the 10% of the population having being infected and 20% of them getting sick and about 5% of them getting very seriously ill. But I said, and I'm sure they should have quoted me on that, that is not the case in Africa. In fact, based on the facts and the data that we have realized that our actual figures are far, far, far below what WHO has quoted. And it's because when we saw the WHO hypothesis, we were a bit scared. So we put a lot of things in place, which the Honorable Minister have mentioned, especially the preventive etiquette, which has become a new normal in this country. Social distancing, ban on social gatherings, and also ban on limitation on or restriction on coming into the country, because we realize that most of the problems that we have in this country were imported. I want to just make it very short that it's not true that Ghana will have 3 million people infected before we reach the peak. It's not true. We will never see that. Because as we speak now, as Dr. Abuaji said, the number of deaths in the country is 9. 9 deaths. If you calculate it according to the percentage of people who have been infected, it's 0.7%.
Dr. Nsia Asare, with those clarifications there, he is a presidential advisor on health. Meanwhile, biologist with the Noguchi Institute for Medical Research, Professor